Good morning.
Good morning.
Welcome. We're talking with Ellen Sontos today. Is that Santos or Santos?
Santos.
Okay, Ellen Sontos today. She's on the Coimbra Protocol. This is our second interview. How far along are you, Ellen?
I started in May of last year.
May of last year. Okay, so
Mhm.
she's probably what, close to 9 months.
Mhm.
She's going to tell us how she's doing today, and um, we're just going to go through what she thinks about the protocol, and she's going to answer some of our questions about that. First, I'm going to read a medical disclaimer for all you lawyers out there, and we're going to jump right to the interview. This is MS There's Hope, by the way. Look us up on YouTube. We have a Facebook page also you can go to. This interview addresses multiple sclerosis and the treatment of it using the Coimbra Protocol. We are not doctors and are not giving medical advice for treatment of your MS. Ways and methods of treating chronic autoimmune conditions vary per person and should be done by a licensed medical professional. We are sharing our own experiences, and this is our testimony of those experiences. Again, Ellen, thank you for doing this. You look wonderful. I'm glad that you're doing better, and jump right in. We have a few questions we're going to ask to make it easier because good old Zoom has cut our time back. Let me jump in here. Oh, um, how do you feel, Ellen?
I feel good. I'm glad to be here. Thanks for the interview. I am coming off of a mild relapse where my face was numb and my mouth was numb. But that's all healing and I'm getting better.
That's something you had before.
No, that was new, actually. I had it on the other side of my face. That was my initial symptom, but it was a different side of my face this time.
All right, that's a point I want to touch on with you people because people think, well, I'm on the protocol, I'm going to start getting better from day one. No, you don't. You didn't get, I tell people this all the time, you did not get sick overnight. You're not going to get well overnight. So if
Hmm.
something happens, you don't freak out, you just wait.
Hmm.
Um, what's been your biggest challenge and how you have you addressed them?
My biggest challenge for sure has been the calcium. My latest blood work came back with my 24-hour urine calcium count was way off. But my doctor wasn't concerned. She said, it's probably because you're not getting enough calcium. So you need to just go back to tracking. I was resisting tracking because I don't like to track my food. So I thought I had gotten a handle on the calcium and I thought I could sort of do it intuitively, but it turns out I can't, at least not yet. I need, calcium's not something I'm used to looking at in foods. So I don't have a good sense of how much calcium is in all foods. And it's going to take me a while to remember everything. So turns out I was only getting like 200 or 300 milligrams of calcium a day. So
Yeah, this is a low calcium diet we do. It's not a no calcium. And that's a mistake that people make, especially the women, because you
mhm.
need calcium for your bones.
Yeah. So she wants me to hit the 500 mark. So I went back to tracking for a couple of weeks and then redid the blood work and the test and everything is fine. So I just needed to be a little bit more disciplined about my calcium numbers.
Now, when you started, because I was going to ask you improvements as the next question, but you didn't really have that many disabilities when you started, did
No, I felt good. So my main thing the reason I started the Coimbra Protocol is because there was so much progression on the MRIs. So every time I went for a follow-up MRI, there were loads of lesions, not just one new lesion, to the point where my doctor was like concerned, like this is a very active case of MS and you need to go on meds. So that's why my marker of improvement was going to be no more progression. And while we're talking about it, my last MRI, the day before I got a relapse, actually, my last MRI, which I was fully expecting to just be bad news, and I was going to still stick it out because it hasn't even quite been a year. It was good news. There were no new lesions.
Oh, I love that. I
Blew
love
my
that.
mind.
What concerns, and let me throw this into you there, people. I had something called TMJ, which people get who don't have MS. It's a nerve in your face. My MS doctor said, I want to do an MRI. And he goes, if it comes back, you have new lesions, you know what I'm going to want to do. And I said, I know. I said, but you know what I'm going to tell you. He would want to put me on medicine and I wouldn't do it. Well, guess what, people? He hasn't called me back. So I'm thinking that's probably good news. All right. What concerns or fears you had that you found to not be true?
I mean, the biggest concern I had was that this wasn't going to work and that my MRIs were going to continue to show progression and I was going to have to decide to either keep going or not. And that didn't happen. And that's the most important thing. I also thought I was going to lose a bunch of hair and I didn't, because I have pretty thin hair to begin with. So that's something that was on my mind, but it's just the same as usual. There was no problem there. On a huge dose of vitamin D. So
I love that. How do you drink your water? What's been your method for, because I just had a question I addressed the other day. Somebody was saying she just couldn't drink all that water.
that's how I got to that point a couple weeks ago, actually. Initially, I was filling one of these up and then just drinking a couple cups through the day would be enough. And because this is so heavy, I think that's all it was. I just didn't enjoy picking it up and drinking it. So I switched to just drinking cups of water, like a nice glass. I knew it was about a cup and a half, so I would drink however many of them per day. That worked for a little bit, but then I got kind of, again, it wasn't disciplined enough for me, so I started to fall off a little bit with that. So what I'm doing now and what's really working is this. This is what I drink my tea in, but before I'll give myself tea, I drink 2 of these, which is 60 ounces. And then I know for me, I need to get 80 ounces. That's what the doctor wants me to be getting, at least 80. So if I drink 2 of these, then I'm close. And I'll drink, like I already drank 2 today. I just chug them. I started to just chug water because initially I thought I should be just drinking water throughout the day. And I know I should be drinking some water throughout the day, but I thought chugging was a waste, but it really isn't. So I chug water and that's it. The thing is, I had to keep switching it up. If something is not working, I need to do something else because, it really depends on the vessel. And so there are always different options. The other thing I want to, I still wake up in the middle of the night to pee. So I'm hoping to drink my water earlier in the day, which is the other reason I'm chugging now. So we'll see what happens with that.
I address this many times on the page on Facebook, and this question comes up a lot. And my advice is flavor your water, drink other things other than water, teas. There's some non-caffeinated teas. You don't have to put sugar in it. You can put, they have a lot of sweeteners, natural sweeteners out there now. Go on Amazon and buy you some sweeteners and put a couple drops of flavoring in your water. That's what I do. I also drink tea. The other thing she touched on there is find something to drink your water in you like. If you only can drink it in an 8-ounce vessel or 10-ounce vessel, drink them. But the main thing is you got to drink it. The other thing I want to touch on is if you don't get 84.5 ounces, 2.5 liters in a day, don't freak out. Just drink more water tomorrow. If you drink 40 ounces today, it's not going to kill you. You're not going to get kidney stones. You're not going to get osteopenia, or nothing's going to happen. I've done it numerous times. Don't make a habit of it. Drink the water. It's important to drink the water. Don't eat the calcium. It's important. But if you eat a little pizza or you don't drink the water one day, don't make your life a living hell by scaring yourself to death. Live your
Yeah.
life. Live your life, people. All right. Anything you think should be addressed?
About the Coimbra Protocol?
Yes.
Yeah, one thing I think should be addressed for women in particular is the bone density, the DEXA scan. So if anyone's starting, I would definitely suggest you get it as soon as possible, because I really put it off getting the DEXA scan. So I didn't get my DEXA scan until about 6 months in, and it came out osteopenia, that I have osteopenia.
There you go.
And
Yeah.
so, I am
Share with them what your doctor said about that.
so the doctor said that, it's not that bad. It's not great, but it's not that bad. She said she wouldn't be surprised if, most of the women my age, especially women who have dieted on and off and been told to like restrict calories and screwed up our metabolism and restricted a lot of food and all of that. She would be surprised if we didn't all have osteopenia, MS, Coimbra Protocol or not, because we did a lot of damage to our bodies if we've been dieting our whole lives. And a lot of us have been dieting our whole lives for different reasons. But, so yeah, she said, she gave me a prescription for boron and K2, or I think it's K2. Yeah, K2. And just reiterated the need to have the 30 minutes a day of weight bearing exercise, which I'm doing. I'm not like lifting all the time, but I'm at least going for a walk every day or doing yoga every day. And I'm definitely trying to push it a little bit more with my workouts.
Do something. Yeah.
Yeah.
Yeah. When you stop, especially, you get older, I'm past 35, believe it or not. When you get older, when you stop, it takes much longer to regain it. And so if you
Feeling
make
that.
a habit, when you make a habit of picking back up as soon as you can, it just
Yeah.
makes it easier. I stayed very active up until COVID. And I had, I was up, standing up and walking and stuff. When COVID hit, my caretaker was terrible. And the physical therapy I had was by video. And it was terrible. And so I just stopped exercising. And when I did, I want to tell you, it set in, and it has been hell getting back to that. I'm working my way back to that, but it's been hell. Well, Ellen, that's all the questions I have for you now. Like I said, you look like you're doing wonderful. I really love you touching on that osteopenia. We talked about this before we um, taped this. Is that a lot of women face that struggle. And what I said to Ellen was, okay, so you're going to quit the protocol because you're getting osteopenia or osteoporosis. You don't understand how bad it is. You don't understand what could happen. It may not, but you don't understand that you can end up in a nursing home, unable to speak, with a breathing tube in your mouth and your neck, a feeding tube in your side. No, you can't even move your head. And people are like, you shouldn't say that. You're scaring people. I want to scare you. I don't want you to get that bad. I've experienced some of the worst parts of MS, and let me tell you, I think that osteopenia or even osteoporosis wouldn't be as bad as having MS. That's my
No, I mean, I used to work with a woman who had osteoporosis, and she worked out every day hard. She just knew what to do and what not to do, and it was something that she had to battle. But yeah, I also know people who have had osteoporosis and who have but been downgraded to osteopenia from specific exercises.
I do too.
There are things that you can do, and yeah, definitely it's not worth quitting the protocol. I mean, I think people are just so scared of the side effects because of the way people talk about the Coimbra Protocol, who don't believe in it, or who are sort of skeptics, that any potential side effect is like so scary. But if you really think about it logically, it's not that big of a deal. It can be dealt with.
One other thing I'll touch on, last thing, is that Ellen said something there about it not being a year yet. People, the protocol can be 2 to 3 years. Now, when I started, I thought it was 2 years. It ended up, when I read something that Christina Keening said, Dr. Coimbra said to her, give it 2 to 3 years and be patient. I was at 3 years, and then I could say that my mind started coming back around and my speech got better, and I could see that my disease had stopped and that some things were starting to gain. That was 3 years. I never, I mean, I was at a year and I was like, come on, man, when's this going to kick in, you know? And
Yeah.
it just had, but you're doing, and I know people that have been 4 and 5 months, and from day one, they started getting better. And by a year, they were doing well.
And I think the sooner you start it, obviously, the better, because
Absolutely.
you have to
Absolutely.
heal.
Well, Ellen, thanks again. I can't thank you enough. I look forward to interviewing you in, oh, I don't know, 3 or 4 months. We'll look at a year
Yeah.
and see how Ellen is doing the Coimbra Protocol. She's doing wonderfully right now. I love the smile. That's one thing you'll notice about people is when you start getting better, you can't stop smiling. Now I'd smile more, but I have this TMJ and it hurts. But and I have bad teeth. I got English teeth.
I got
But
some crooked teeth.
you'll notice that people, you'll notice their face, because when my disease stopped, I had a smile on my face and you couldn't get it off with a crowbar. I mean, I just felt so good. And Ellen does too, I can tell. All right,
Yep.
Ellen, take care.
Thanks
We'll be
again, John.
We'll check in again with you in, oh, I don't know, maybe 4 months, 5 months,
Sounds good.
something along there.